What up? It's the PAC, man. All things physician associate. And in this video, I want to talk to you guys about what an employer is thinking when they offer you a job, right? So essentially, imagine you're an MD and you're working in a practice and your practice is growing and you need help. You know, you're burning yourself out. You're doing okay, you're doing great, but you're burning yourself out. And you got a lot of overhead expenses. You have to pay the practice, you have to pay the staff, you have to pay all these licensures, all this liability insurance, etc., etc. The lease on the office space, what have you. But you're growing and your lobby is full and patients are waiting a little bit too long to see you, and so you need help. And you decide, you know what, I'm gonna hire a mid-level provider, someone that just could kind of help ease the load a bit, and you decide to, you know, pick up a PA, and then here comes this PA, new grad, zero experience, the greenest plantain you ever seen in your life, and I say that respectively. I was obviously there, and then we come through the door. We want $100,000 a year, like right off the bat, and we're like, whoa, like. I don't mind you, I meaning I'm the employer, I don't mind paying $100,000 if you were producing for me. Meaning, you remember, your rewards in life are always in exact proportion to your contribution and service. That's like my life motto. That's Earl Nightingale quote. And I feel like I don't mind paying you that if you're worth that, but you want me to pay you $100,000 a year and you don't know your foot from your hand? Like, you don't know left from right. I gotta teach you everything. Yeah, PA school downloads a lot of information in your brain, but that information is just, it's like a big jumbo. Like, it's not, I gotta organize your thoughts and help you to start applying what you know. You know, like that takes time. And so most MDs or what have you, employers will hire you, but they're like, look, man, you know, I can give you 80 year one, and then we could sit back down year two and see based on your productivity where you're at. And it's fair in the sense of, wow, somebody's paying you $80,000 a year to train you. It's like a residency. And when you think about it, not even MD, not even a doctor residency pays $80,000 a year. Those guys make on average like $50K a year, and for 4 years. And even a fellow, most fellowships don't make $80,000 a year. There are several that do, but most don't. And then it's like, whoa, like, you're asking more than a fellow. A fellow is the most trained individual outside of being just your own, like, MD. Like there's nothing more trained than a fellow, to me. And so the fact that even that individual is not getting paid as much as what you're asking for is like, come on. So it's understandable in that sense. And then, so I use that to segue into a salary hack. Yeah, dun, 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 the salary hack. How do you get to $150,000 a year fresh out of school? So the way you do it is, and this, by the way, is all in my mind. For all I know, none of this works. But I do know it works though, because I've recommended someone to do this before and they've done it. So I don't know if it works every time, but certainly something to consider if you're out there and you're willing to take this type of stress on, right? Because nothing comes free. But whatever, here it goes. So most MDs, as I just mentioned, are a little bit overwhelmed with their practice. They're very busy. So ideally, when they hire someone, they're not always looking for full time. Let's say it's a surgeon an orthopedic surgeon, and they're 2 days in the clinic, 3 days in the OR. Now, while they're in the OR, they're losing money because, I mean, they're not losing money, they're making money in surgery, but they're losing potential money by not having someone in the clinic seeing patients. Like, you could have had a PA seeing new patients and setting them up for surgery for you to keep your surgery days booked. So you're losing potential money. And so what I like to propose is, when you interview, don't be afraid to take on a part-time position with the doc or with the practice, and tell them, look, I'm willing to work 3 days a week for $75,000 a year. You could fill my schedule up. I'll see all your patients, and I'll keep you busy. I'll keep your surgery days. The other 2 days of the week you were gonna be in the clinic anyway, so you don't need me there. But the other 3 days that you're in the OR, I'll see patients all day long. I'll see the follow-ups. I'll see new patient consultations. I'll set them up for you. If you think if I believe they need an X-ray, an MRI, a CT scan, whatever the case may be, I'll line them up for you. $75,000 a year. Now, in that person's mind, they're like, wow, more patients coming in, doing more surgery, generating X amount of more money for me per year, and it's only running me $75,000 a year. I'll take it. So what happens then for you? So you're only making 75, but you're free 2 days, 2 weekdays. You can easily approach another practice, let's say either in a different specialty if you want to not burn yourself out in one particular specialty, or in the similar specialty so you could become just the master of that specialty. You can approach another orthopedic doc and say, hey doc, look, I'm an orthopedic PA, right? Because now you're faking it till you make it. You just got hired by one place, and you're like, look, this is what I do for another practice. I ease the load by not, imagine when you come into clinic day, you're super swamped because those are the only 2 days of the week that you're able to see patients in the clinic. So imagine if you came in and you can actually breathe and focus on the business and not on the day-to-day, right? Not on every single patient, every waking moment. I can ease that load for you by having you, if you bring me on for 2 days of the week, I can come in and see patients. So you're not seeing 30 patients on your clinic day. You're seeing a fraction of that because I came in on off days, on your surgical days, or I can come in with you on your clinic days and see the patients with you. And I could do that for $50,000 a year, 2 days. And they look at it like, oh man, like for only $50,000 a year, I don't have to stress myself out on clinic days. I'll take it. And now you filled up your week. And what I mean, you're at what is that? You're at what do we do? We're like at $125,000 a year, I believe. Yeah, and you did it essentially by just kind of fixing someone else's problem. Because remember, that's all a successful business is, a business that can solve someone's problem. And that's the problem in the healthcare field for these docs. So if you could be that person that could ease that problem. If you're out there ambitious, you're hungry, and you want to pick up some Saturday work too, let's say, you can easily approach one of the two docs and say, hey doc, your patients that get admitted into the hospital after surgery, I know you have to go there on the weekends and round on them just to make sure everything's okay. I can show up in the morning, round on them, make sure they're doing okay post-operatively, do a note, leave some orders for the nurses, and then they can call me if they have any questions. I could be the on-call person. Excuse me. You can do that for both docs and say, and I can do that for $25,000 a year. You don't have to worry about showing up to a hospital on a weekend or in the middle of the night because the patient has some post-op complications. And if you can pull that out of both docs, which either one of them would love to not have to show up to a hospital on a Saturday, and you just graduated, so you're hungry, right? And that's an additional 25 per doc. Now we're at 175. The creativity just never ends. I think it's better than just sitting down with a doc and saying, I'd like $150,000 a year and I just graduated. Are you high? All right, no, but I divert. But that would be a creative salary hack. Anyways, video got too long for me already, but I hope this reaches the right person. If you guys have any questions, you know where to leave it. Love you.